Hello and welcome to Chamber Chat TV with the Greater Lowell Chamber of Commerce. I'm Danielle McFadden, President of the Chamber, joined by
Karen Bergeron, Vice President.
And after this month, you're going to be having some guest co-hosts for a few months.
Yes, but we will have to bring a picture in of the new baby chamber. No, chamber baby.
Sure. I would be happy.
We've been saying that. For 8 months, we've been talking about this baby.
The chamber baby. Karen calls it the chamber baby.
I do. I call it the chamber baby.
And we are joined by Dr. Ian Barwick, who is a local family dentist in Dracut.
Correct.
How you doing?
I'm doing great.
So you do so much, so we're excited to kind of dive into some of the aspects of your business. Can you tell us a little bit about your business?
Sure. Well, we're located at 1345 Lakeview Ave in Dracut. We've been there for about 12 years. Before that, we were in the Tennis Plaza, well, the Dracut Tennis Plaza, which is not called the Tennis Plaza anymore. I've been practicing in Dracut for over 30 years. I'm a member of the Greater Lowell District Dental Society and the Merrimack Valley District Dental Society, American Dental Association, Academy of General Dentistry. I used to be president of the Dracut Rotary for a while.
Wow.
Oh, wow.
Yep.
Very embedded.
After I graduated dental school, after a few years, I realized that there were some things about dentistry that I wanted to learn more of. And so I took further advanced education at the LD Pankey Institute, which is down in Florida, which is, they're kind of the folks who go to the cutting edge of dentistry and train other dentists in things that are hardly known of and researched highly. That's at the Pankey Institute. I have one daughter, 2 stepsons. I'm married, 1 granddaughter.
Wow.
And let's see, I like music. I actually wrote the theme song, the current theme song for the Dracut High School telethon that they have now.
Oh,
and once in a while,
that's
when I get my chops together, I'll perform for the telethon as well.
Oh, that's wonderful. You're really embedded into the community. Very much. So you've seen a lot of changes in dentistry. What are the most dramatic changes?
Well, I would say the most change I've seen in the last 30 years has been in the materials that we use for restoring teeth. For example, I don't do silver fillings anymore, not because I think they're highly toxic or the mercury is poison or anything. I just don't think that silver fillings have been kind to teeth over time. It is a metal. It's a metal alloy, and silver fillings expand and contract with temperature. And as you know, mercury is in the old thermometers that used to be used, and that was what they depended on, was the mercury expanding and contracting, and for you to be able to read the temperature. So now we're using probably maybe the 6th or 7th generation of composite restorations, which is kind of like a urethane base almost with a microscopic glass filler. And with these materials, which you can think of as a plastic, but it's a very durable plastic because it has glass filler in it, it's as durable as a silver filling if it's placed properly. And you can actually bond the interior of the filling directly to the tooth, which is not something you can do with a silver filling. Some other things that I've seen that have been more recent advances, well, I say more recent, in the last 15 years, excuse me, more and more commonplace has been the use of implants, and I brought a couple of pictures with me. Implant-supported crowns, for example, look something like that.
Wow.
Where the implant is actually taking the place, we call it a root form implant, and a root form implant takes the place of the root, and once the implant is placed into the bone, it takes the place of the root, and you can just build a new tooth on top of that.
Interesting.
So this doesn't take the place of having a root canal on a tooth, but if you have a tooth that had a root canal or isn't appropriate for a root canal, or if you've lost a tooth a long time ago, it can be replaced almost magically.
Wow, that's amazing.
With an implant. And what's even more distinctively important is that nowadays we can have implants placed to support dentures, especially lower dentures.
I've heard so many people say that they cannot get a really good grip with the lower. This is absolutely astounding.
Well, most people don't have a terrible time with their upper denture. Most people, I'd say 95%, because it goes on your palate and it goes across the back of your palate, and there's soft tissue there, and you've got kind of a suction cup effect. Unfortunately for the lower denture, God put your tongue right in the middle of that, and
What
so
was he thinking?
Beats me. So for folks who have a lower denture, especially folks who have had a lower denture for a long time, the ridge on the bottom has disappeared, and to place a couple of implants to attach to the interior of your denture, that literally snaps into place.
And you can hear it snap.
Oh yes.
Yeah.
Yeah.
Interesting.
And what's nice is the devices that go inside the denture are kind of a Teflon material, and if those wear down over time, you can just replace them, at 12 to 18 month intervals. So now you've got a person who may have been confined to their home, can't go out to eat, doesn't want to visit relatives because they can't take their denture out, or they can't eat with their denture. And it's kind of a life-changing experience for a lot of people who
They're probably enjoying a lot of foods that they couldn't for a long
That's
time.
correct. One other thing that has been a real recent innovation has been computers being used in the dental office. For example, we can do CAD/CAM dentistry now in the office by taking a laser scan of a crown prep, and we can actually mill a crown. This is what computer-aided design and computer-aided manufacturing brought to dentistry, and we can actually manufacture a porcelain crown out of a block to fit the tooth just from scanning into the computer with a laser.
This really helps streamline your business.
It really does.
To have access to those
Really does.
types of programs.
And the restorative materials, again, the restorative materials that we're making crowns out of now don't involve so much reduction of tooth structure that we used to have to do. The materials now are very much harder than porcelain. Although we're still making porcelain crowns, you can make zirconium and even harder materials than that. It's kind of neat. So instead of having to have a gold crown, on a way back tooth, now you can have a porcelain crown, although it's not actually porcelain. It's made out of a more durable material.
You have a lot of cutting-edge systems and devices within your practice. Can you talk about some of those as well?
Well, I brought one of them with me. Actually, I was going to bring another one with me, but I forgot one, and I brought one.
I love show and tell.
This is this is an intraoral camera, and essentially this just plugs into each one of our operatories. It's a regular USB port, and what we can do with this, of course, we put a protective sleeve over this, a cellophane barrier, so that we're not, going between patients. But you can see the lens on the end there. It's very small, and there's a light. We plug this into the wall, and we can bring up an image of the patient's tooth, which is that small. We can bring up an image on the computer that's 30 to 50 times larger, so that we can visualize cracks in the teeth or little microscopic areas where there might be decay. So we usually do that. It's kind of a survey that we go around tooth by tooth and look at some of these silver fillings that we all had silver fillings when we were younger, and they're all getting corroded and decayed and things like that. And so we can look at those with the intraoral camera and show the patient tooth by tooth, what we can see.
And you can see that in ways that you couldn't years ago.
Absolutely.
You couldn't see a tooth in that same.
Yeah. One of the consultants I worked with said it takes away the who says so factor. You've got a cracked tooth. Well, show me the crack.
Yeah.
And you don't have to hold a mirror up and try and find
And it's
it.
50 times the size too. That looks like a big crack.
Yeah. So it's rather dramatic to be able to see what's going on inside your own mouth. Another device that we have is something called a diagnodent, which is a laser-assisted. It's like a little pencil-sized device that you can go around and check the biting surfaces of each of the teeth, especially in the back, where you normally, in the past, when the way that we would find a decayed spot would be visually, or with a little sharp explorer. If the spot pulled back, that meant it was soft and that was decay, or by way of an X-ray, or by some symptoms. But this is a laser-assisted, it's an FDA-approved laser-assisted cavity detection device that actually looks down inside the tooth. So you might not be able to see anything on the outside of the tooth, but these lasers don't lie. It essentially measures how long it takes for the laser beam to come back and register with the machine. And so we can detect lasers that you can't see or find in any of those other previous ways. It's rather fascinating. And of course, another device that we have is what we were talking about before, the E4D machine, which is our CAD-CAM device that enables us to make our own crowns right in the office. It's kind of neat.
You're really cutting edge.
You are, and I mean, you do the work in-house, so it's not like, well, I'll have to send it away for a couple of weeks and then we'll tweak it.
Sometimes we do. We do both, but it gives us that flexibility. And in addition to that, most everyone nowadays is involved with digital radiography, so that there's no more waiting for the X-ray to come out of the tank in the other room. You take your picture, it comes up on the screen. If it didn't come out appropriately, take it over again. And since it comes up as a JPEG image, you can send it back and forth to specialists and let them take a look at what you're seeing. And if we do referrals to someone else, we take an X-ray and email them the X-ray.
Wow.
It is amazing all
Really
that
is.
you do.
It's a wonderful time to be doing dentistry. It's kind of
Very
neat.
exciting.
And the last system I wanted to talk about, the newest system that we have in the office, is that we're helping to screen and make appliances for folks who have snoring problems or serious sleep apnea problems. In times past, the only way that someone would be able to manage their breathing obstructive apnea would be with the use of a CPAP, a constant pressure air appliance. And as you can see, they're kind of cumbersome. They can be a little bit noisy. They might be a little irritating on the face. But this is the gold standard, okay? And we let people know this. If you're diagnosed with sleep apnea, you should be wearing one of these. But the compliance rate, unfortunately, for folks wearing a CPAP is extremely low because they can be cumbersome. You know, they're very hard to carry around if you're going on a trip or something. This is your overhead luggage. Here is your CPAP machine. And so we can make appliances to help folks to do that. So what we've started doing in the office is a systematized approach to screening folks. We started with our own relatives, and as we were getting practiced up at this, and met with a great deal of success, and moved on to essentially questioning our patients. Are you a snorer? Is your husband a snorer? Do you know anybody who's got sleep apnea? And it's developed a huge series of communications between, well, I don't snore, but you know, let me tell you about my husband. You know, conversations like that. So, or a friend has this, and you know, my friend has this, my boss has this, and he won't wear the CPAP. He can't wear it. So we're inviting people in for consultation visits, and we have the ease of motion, essentially, of we have a home screening test that's been approved by the American Academy of Sleep Medicine that is called a WatchPat, and I didn't bring a picture of that either today, but it's a very neat little looking watch-looking device. If you've ever saw a Dick Tracy device, you know,
wow!
it's a computer that you wear on your watch. It's got a finger cot that goes here and another little device that wraps on here, and you wear it for one night. It's got a little microphone that sits on your clavicle up here and measures how much oxygen you were saturated with during the night, your pulse rate, your loudness of your snoring, how well you slept. It measures essentially your REM sleep, how deeply you slept, the different positions you might have been in during the night. So to use this device to screen someone for sleep apnea or snoring, it allows us to let them know whether they should go and have a legitimate hospital sleep test, doctor-supervised sleep test in the hospital or not. Because it gives us some readings back. Not only does it give us the indexes that we look at, but it also prints out a narrative in lay terms.
Wow.
You know, the normal index for this is 5, you were a 14. You know, you got a pretty good amount of REM sleep. You slept most of the night on your back, you know, that kind of thing. So it's a real neat device. It's a real neat device for doing that.
If you can believe it, we have about 30 seconds left.
Unbelievable.
So I want to give you the opportunity to say
Well,
anything that you'd like
let me show you like one device. This
hear.
is a sleep apnea appliance. That's much easier to wear than the other device. This is actually the one I wear, so this is not mine, but mine's at home. but this is called an EMA appliance, and they're very easy to wear. One thing I did want to talk about was the future of dentistry. I think what you're going to be seeing more and more of in the future of dentistry is more computer utilization. You're going to be seeing more and more restorative materials that are harder and harder and more durable. And I think you're going to see some biological changes in terms of being able to predict people who are going to be more prone to periodontal disease, dental decay, and maybe even some vaccines, you know, for something like that.
Very fascinating.
Wow.
Why don't you give your information so that folks can get in touch with you, because I'm sure they'll want to hear a lot
Great.
more
We're
about
at
what you're doing.
1345 Lakeview Avenue in Dracut. Our website is www.ianbarwickdmd.com, and I'm also on www.snoringisn'tsexy.com.
That's a perfect note to end. I like that. Well, thank you for joining us
You're
today.
very welcome. It was my pleasure.
And remember,
this was great.
snoring is not sexy.
That's correct.
We'll be back.